This is the Pediatric Transplant Hepatology program and is in here in the University of Nebraska Medical Center in association with Children's Hospital Medical Center. Children has been here for a long time now. They have the clinical aspects of medicine. They are affiliated to University of Nebraska Medical Center, have contributed to become more academic, develop research endeavors, educational endeavors, have a set of missions that are really wide spectrum rather than be more of a community hospital. It has become an entity that it has a big presence in the region. Someone told me once, you want to pass on what is not in the books. I'm going to teach you what you will not find in the books. It's the experience. University of Nebraska Medical Center is a very fascinating place. It's a pleasant surprise when you come here for the first time and realize that in the middle of the Midwest, you find an institution to this level. This transplant program has been here for decades now and have become leaders in the nation and perhaps in the world in the area of transplantation. Whoever comes here to be trained will be exposed to a premier approach to liver disease and transplantation being part of it. We were probably one of the first programs to do a small bowel transplant. This is a place that usually other institutions will look up to.
We do isolated liver transplants, but we are also a good program of multivisceral transplants. They will have a bigger, more broader exposure to different type of transplants. We do other types like living donation and split transplants that are not available in all the transplant programs.
When I'm not on service at the hospital, we have clinic over at Children's, and we see just pre-transplant liver disease. Other times we're working on research, teaching residents, teaching some of the GI fellows. We also have a few different rotations that they offer here to kind of strengthen our experience in transplants, and I can be strong when I go forward into my career.
Everything's at the Children's Hospital is built for children. But there are some certain things that at the university here would offer, such as more library, resources. It's kind of complement each other.
We have right now 4 fully trained pediatric transplant hepatologists, and the candidate will be exposed to four of them. Then that tells you that this is a busy practice when we need that many people just dedicated to liver. We want our pediatric transplant hepatology fellow to be self-motivated. We want that person to really be eager to learn, to come here, learn a lot about the clinical management, how we follow protocols. It's important also to be someone that cares.
I think that the dynamic with colleagues here is one of the best parts about working at UNMC and at Children's Hospital. My attendings are wonderful. They're people who I can just shoot the breeze with, chat with, and we have lots of staff kind of helping make everything happen other than just the physicians. We have dietitians, we have pharmacists, we have nurse coordinators. We have so many people that make our team run so smoothly that I feel like I'm spoiled on a regular basis because I can concentrate on the medical issues for my patients.
When I moved here to Omaha, I was pleasantly surprised that how many things happen in this city. You have a lot of different activities, sports, baseball. Finding the University of Nebraska Medical Center in the middle of this city, I have been very impressed throughout the years because this is a well-known place. They do a lot of good medicine here, and being in a city that is not overwhelmingly large, then I think that has been something important for me because also it's a family place.
Living here, it's a small city, and it's like everything is close by. Everything, I get in the car and I reach my place in 10-15 minutes.
At the end of the program, we want them to, the candidate, to understand what are the things that are needed to make a patient a candidate for transplant. What are the things that you need to look at or important for you as a clinician to improve outcome of transplant.
This is a great opportunity, I would say, to have some experience in, and would probably invite all the fellows to at least take some, this opportunity to have the experience.
This place will give you the tools to become a good gastroenterologist or transplant hepatologist because of all the exposure that you will get.